My name is Marcus Peck. I'm a consultant in intensive care and anesthesia at Friendly Park Hospital, a hospital just outside London. I'm also the co-chair of the POCUS Ultrasound for Intensive Care Committee, the FUSIC committee that's run by the ICS. And I've been involved with that since its beginning in the sort of embryonic days of 2010, where we were starting to talk about running POCUS accreditation here in the UK. So, and I've been chairing the committee, first the FICE committee, the cardiac stuff, and more latterly the sort of combined committee for quite a long time now. I use POCUS every day, largely for diagnostic purposes. Obviously, interventional POCUS is important. It's very good for looking for fluid and sticking needles into it and draining it. But for me, predominantly, it's diagnostic. And you can look at lungs and really know whether the problem is primarily a lung problem or a heart problem. It's very important in shock. There's a million reasons why ultrasound helps you clinically in a shocked patient to instantly rule the problem in, to exclude diagnoses, and particularly look at the whether this is a left heart problem or a right heart problem, because the treatments are different. And actually looking and determining pure right heart failure is quite difficult to do clinically without ultrasound. But it's also useful in other organ failure too, so renal failure and liver dysfunction, to look at the sort of the right side of the heart and congestion, which we're increasingly aware of now, and find that really useful clinically. So yeah, I work in intensive care and diagnostics. I don't think I could do my job without it. It's taking an increasing role in healthcare. We began this journey in 2010. We're over 10 years after that, and the training program is just the access to FUSIC training has been in a linear increase. We're teaching 600 people a year now, probably more, and that just indicates the sort of the ground up interest in this stuff, at least here in the intensive care world, and I know in other specialties too. And that's driven by awareness and training, but also availability of machines. And that's, really, they're very widespread now, particularly since COVID. So there's really no excuse not to be able to do this stuff. The next challenge, I think, is moving this further back into maybe undergraduate medical training. And we're really interested in that. And we're looking into that at the moment. So yeah, POCUS is becoming a mainstream everyday thing, which is great. And I dream of the day when every sort of frontline clinician has those skills. When you're a busy clinician working in any field at the moment, here in the NHS worldwide, I'm sure we're all the same. Life is busy, and I think having access to the kit, it definitely makes it more used and more integrated into care. So, especially units that have, multiple machines, how lucky they are. But, even just to walk from one end of the room to the other, switch it on. And, it's all sort of extra work, which, can be difficult to manage, particularly when you're running the floor. So I think having a machine that is on your side, potentially, that's quick to boot up, all of that gives you access, and access gives you the opportunity. But I think it goes more than that as well, though. I think having a machine that you can really get to know inside out gives you the really kind of the detailed understanding of it and all its sort of intricacies. And I think that's a good thing. I think, having something you can have at home, really get to know, I think will make it more accessible and more efficient. As far as treating more patients, in the world I'm at, they're limited to the beds I've got. But I think it would certainly give me more opportunity to use ultrasound if it's as easily accessible. And I just say, I do work, part of my job is in the outreach team, medical emergency team response. And that's really where it comes into its own, is when you're leaving the ICU and going out to the ward or the emergency department, where you have your own machine, you can whip it out whenever you need to. And, so it's clearly the future for us all. And the day that we all have something as small as can be, but as powerful as can be, that will really change the face of what we're doing. Artificial intelligence is really exciting to me. I think it's exciting to everybody. You only have to look at the effect Chat GPT is having on on the world right now, and the, you know, how incredible it seems. And I think, you know, this level of excitement and you know, usability is likely to impact on ultrasound and POCUS, you know, in the years to come. It's somewhat held back a bit by the regulators in around the world, and that's sort of understandable. They're just trying to catch up with this new technology to work out what it means. But the impact of this down the line is going to be immeasurable. A bit like ChatGPT, which you know, people can be in awe of the sort of the production value, and it really does look as good as humans can write, perhaps even better sometimes. That kind of level of ability, I think, will be realized in ultrasound, and it will be very obvious to us who use it that it can do things that's, you know, as good as a human, potentially, and maybe even better. The experts who do echo have been historically very worried about the development of POCUS because most of them don't record measurements that don't fit their opinion from what they've seen by visual assessment. So in fact, they'll exclude outliers, you know, and not record them, and because they don't represent what they're seeing. And I think that's probably an important bias. It's probably, you know, makes it better. That's what, you know, I think that's what they would say. And of course the opposite is an inexperienced person who doesn't recognize that and then records and interprets outlying measurements. So the whole culture of POCUS has been perhaps not to measure stuff. But when you've got AI driving the interpretation with sort of frame by frame analysis and you know, and I think in time there'll be, you know, pretty perfect measurements from it. I think, you know, we'll find that they'll be as good as they can be. And I think you know, the reference value for AI, the stuff that the machines learn from, is obviously the ground truth of experts making interpretations. And but we know when experts do interpret stuff, they're not as precise as we'd like to think. There is some variation, and I think AI will reduce that or increase the precision, reduce the variability, and I think that's going to be a good thing down the line. But, you know, only time will tell. I think the big thing though will be when experts are do their own measurements and then allow the machine learning measurements to happen. And then I think, you know, well, we'll only know in time, but I should imagine they'll be concurring quite well. And once that happens, I think we'll be able to trust it and use it. And then we make massive leaps forward, perhaps in terms of access to more advanced elements of ultrasound. You only have to look at the speed at which this kind of stuff operates. You mentioned the Kosmos, and that has an annotation function. And honestly, it's mind-blowingly quick. Yeah, I think when we have more experiences like that, the adoption is going to be very rapid. If this is going the way I think it goes, I think we'll be able to adopt things that are considered to be out of reach at this point. Measurements, for instance, you know, the use of Doppler and so on. I think that at the moment the belief is that we should have a very, very basic system or a completely advanced sort of provider training accreditation, and there's a massive gap in the middle. And that gap's the most important bit. That's the bit that we need to be doing as intensivists and acute physicians and emergency physicians. We don't necessarily need the highest level of understanding and experience and accreditation, because that's for specialists. But I think we need that bit in the middle. And I think this is where AI is going to open that up to more people. I think once we've realized that it's deliverable and accurate. I think what I've seen in the education side of it, and the ability for Kosmos and other machines to locate the views, it is incredible. You know, as a trainer, I've done this for a long time, and I'd say I'm, you know, still on a learning curve with recognizing images and knowing exactly how to advise somebody to change the probe. But the AI in these models and software is amazing, you know, and it really is clear that, you know, you need to slide this way, you need to rotate, tilt the beam, So I think, I could quite easily imagine a future where semi-trained people might be able to pick this probe up and be guided, to the view, with relatively minimal training, and that then opens up quite an exciting world for use, certainly in the intensive care unit, I'm sure, and beyond. So I think those things will increase the use, and if we increase the use, we're going to know more sooner, and if we know more sooner, then I think we'll have more timely diagnoses and potential interventions. I think there are links there, but time will tell. We have to look at each of those stages with scrutiny, but I can easily see that being the future. The cloud allows us to break location, from the person acquiring the images and the person interpreting them or training them. It's difficult. We're all busy. Our lives are busy. We're busy clinically when we're in the hospital, but we're also busy when we're not. And I think the fact that we could plug in and out and help train people, not just in the room, but actually elsewhere in the building, or even in a whole, miles away, that's going to really, really help resource and make deliverable, training, and also quality assurance. Where I work, the system I work in relies heavily on goodwill and the our time, and it's mostly unfunded. And I think if we can do more remotely, I think we'll get to where we need to be, which is the moment someone needs an expert opinion, they can just click a button and and log in. Someone else can plug in and talk it through. I think these are really important for training and quality assurance in a timely fashion. The Kosmos has some fantastic features that make it stand out at the moment. Very clearly, well, I mean, it's got lots of strengths. It's ergonomically well designed. It's very easy to work through. I think the sort of digital interface is very intuitive. But its real strengths are what it can do. It has spectral Doppler in the full. It's got all the kind of modalities that we need, and that really makes the difference when you're outside the unit and away from your cart-based machines. So so I think there's a huge benefit. I think the AI indicates how good the potential is for sort of automatic interpretation. I really like the fact that you can do all this without an ECG, and potentially it can tell you whether you're in systole or diastole from the sort of frame interpretation. And I think, although I'm still just at the beginning of getting to know that, the sort of cloud-based diagnostics from Mus2 AI, that really promises something that's really different from any other machine I've been involved with. It shows how much EchoNous is looking to the future. I'm sure other companies will be following suit, and I think I love the way vendors seem to kind of support each other and celebrate each other's wins, and I think we're all sort of celebrating that behind the scenes. I like to think that that will continue to be growing. I think the sort of cloud-based interpretation, the machine learning interpretation of things like spectral Doppler traces, where it can take one look at it and instantly know the answer, rather than having to trace around it. That promises some really great things for the future. And I think machines like Kosmos, which have spectral Doppler embedded inside them and the ability to automatically interpret that without many more extra steps, that really does offer a lot for the future in terms of workflow and the ability to do things that perhaps are slightly out of reach at the moment.